Joining me now with the latest on COVID-19 in our region is Medical Officer of Health, Dr. Paul. Welcome back to the show, Doctor.
Good to be back, Gabriel.
All right, so the month of November was certainly better in terms of COVID-19 than the month of October was, but today we were looking right into a very big jump in cases.
Yes, we've added as of today 43 cases, and 18 of which are in the Cornwall area, 20 of which are in the Prescott Russell, and 4 are in SDNG, and 1 in Akwesasne. And so that is a big jump, a one-day jump. And you recall over the weekend we actually added number 33 cases. So we're really added a tremendous number of cases. And so, as always, we're trying to look at where the cases are and what the sources are. And in the majority of these cases, they are really related to either a workplace, somebody went to work and then infected a couple of other people and went home and infected a couple of other people as well. So they're all clustered. Most of them are clusters. Some are in schools, some are workers going to work and infecting other people at work, and then people going home and infecting their own. So we know we can trace them. But that still doesn't erase the fact that we have increased numbers in our community. And so I think it's very important that we continue sending out the message that we need to ensure that, A, we don't go to work when we're sick, and B, when we go to work, a lot what we're seeing, Gabriel, is that a lot of people at work, regardless of what the work setting is, they do an excellent job when dealing with the customers or the public or whatever. But then when they go to the back into the kitchen or to the lounge or even in carpooling, they take off their masks and they sit side by side. And that's where we're seeing a lot of the infections take place. And this is in a multitude of workplaces. So that's very important for us. So A, don't go to work when you're sick. And B, that even if you are not feeling sick, if you're going to get sick a couple of days later, you've actually been contagious a couple of days before. So, when you're even feeling well and you're sitting down, beside somebody in the kitchen, literally shoulder to shoulder, and they're sitting there for about 45 minutes, an hour, eating and talking, that you're spreading the germs to each other. And in many cases unknowingly, and some people would go to work with symptoms as well. So it's very important that we sort of look at those, what I call those blind spots, because that's where we're seeing a lot of these breakthroughs. And then these individuals take it home, then their kids get it, and the kids go to school, and then we have to, have cases in the school. And again, majority of cases of the schools, we've added more schools today to our list. The majority of the cases that we've added to the schools come from the community and do not really result in more than one child getting it or one individual getting it, except when, again, in workplace situations where a teacher or a staff may be mingling with other staff. And again, when it comes to protecting the public and, in all these workplaces, they do a great job. But don't forget that our blind spots are when you're carpooling, when you're in your staff lounge, or when you're eating in your staff kitchen. You still have to take the necessary precautions.
And as a result of some of these numbers, of course, we're always looking at that 7-day rolling average. And as we were creeping down throughout the month, we're starting to creep right back up towards that orange zone right now.
And that's right. We're right at the level of the orange zone, going into that zone. If we continue that way, I suspect that the ministry was going to want to put us in the orange zone, which I don't want. Nobody wants. And so I think the best way to do it is, again, just let's look at our numbers. Let's collectively try to bring down those numbers as much as we can. Let's try to have a nice, quiet holiday, with only our family, obviously, no mingling and those type of things outside of your household, because it's very important for us to try to keep these numbers down as we move into the new year. And at the same time, again, you're seeing let's look at those blind spots. Make sure that you think twice about going to work, and when you're at work, take those precautions. Don't take it for granted. Just because you have no symptoms, you're good.
And you alluded to the holidays, Doctor. The province released their recommendations very to what you just said, but the Eastern Ontario Health Unit has theirs as well. Maybe you can elaborate a little bit more on what your recommendations are for Christmas in a little bit more detail.
Yes, well, and we released those when we were sort of solidly in the yellow zone. Now we're going up into the orange territory, and it's even more important. So what we had said is that this year is going to be different. we strongly recommend that you do not receive people from outside your region, don't travel outside your region, and you don't have others at your home other than your family, with some rare exceptions if there's only one individual that lives alone and so on. But in general, your family should just be celebrating on their own, celebrate virtually with others, and those type of things. And that is even more important now as we're treading up numbers to be able to do that, because again, we want to keep those things down. And we also have a whole slew of tips on how to safely exchange gifts and all these things there. But again, the main point is, just like the government, the provincial government has recommended, and by the way, now even Quebec has changed their approach, is to stay at home with your family only and celebrate it with others virtually only. And again, I repeat, do not travel for outside of our region or come into our region for non-essential reasons.
And at the end of the day, it makes for a different Christmas, but it's a temporary sacrifice that's really going to make a big difference heading into the new year.
It really will. We need to be able to come out in January with as low case as possible. It just makes it easier for my staff to be able to then concentrate on the vaccines, because they're coming around the corner in January, so we can start deploying those. And if our staff are being pulled in two directions, same for the hospitals and so on, it'll be a bit more difficult for us to get the vaccines out. So the better we control the virus, the lower it is, the easier we'll have time in January to getting the vaccines out, as quickly and as soon as possible after their availability comes into our area.
And you just alluded to those vaccines. Maybe we can end on that on a little bit of a high note. Although the forecasts, not all Canadians maybe receive the vaccine until next September, but at the very least, we're really inching towards that finish line when it comes to a vaccine.
Well, yes, we are. And I can tell you that I'm very confident that particularly in our area, particularly our seniors are very vulnerable, will be the first in line. And I am very optimistic that we will be coming out of the holidays ready to go sometime in January for that population. And as we get vaccine trickling in, we'll be able to make it much more available, probably into the March, April time frame. So yeah, this is that proverbial light at the end of the tunnel, and it's looking good.
Excellent. On that note, Doctor, thank you so much for joining me. And of course, we'll continue to keep a close eye on these numbers and that vaccine that's on the horizon.
Yeah, thank you.